Hi, I'm Gary Diamond. I'm a professor in the Department of Psychology at Ben Gurion University here in Israel. And I'm here to talk to you about our recent paper in Family Process titled Attachment-Based Family Therapy for Sexual and Gender Minority Young Adults and Their Non-Accepting Parents. This work was done with my co-authors and colleagues, Rotem Barachovich Zamir, Ophir Nir Gottlieb in Balgat, Inran Bar Khalifa, Priel Fitosi, and Shira Katz. And this work stems from an understanding of the critical role that families and parents in particular play in the lives of their LGBTQ children. Indeed, there's a growing body of research showing that parental support of their child's minority sexual or gender identity is positively linked to their child's well-being. Such parental support can be manifested in many ways, including when parents tell their young adult that they're proud of them, show interest in their personal life, use their chosen pronouns, express a desire to get to know their friends and partners, encourage them to be their authentic selves, come out to their own parents, extended family, and friends, and advocate for LGBTQ rights. Parental acceptance not only promotes young adults' self-acceptance and self-esteem, it also positions parents to serve as a sanctuary for their LGBTQ young adult as they cope with the effects of minority stress experienced outside of the family. In contrast, parental rejection can take an enormous psychological toll. Such parental rejection can manifest itself in many ways, including when parents make hurtful, homophobic, or transphobic comments, invalidate their young adult's experience or identity, explicitly disapprove of who they are, induce guilt by saying things like "you've ruined the family," are coercive, controlling, saying things like "don't bring your girlfriend home for the holidays," and via everyday microaggressions. Such messages from parents can be internalized and negatively affect the young adult's sense of self. And they can also undermine the attachment bond. They leave the young adult feeling disconnected and that it's not safe or helpful to turn to their parents for support when experiencing discrimination or victimization outside of the family. Indeed, research has shown that parental rejection is associated with a number of negative psychological and health outcomes, including internalized homophobia, expectations for future gay-related rejection by others, increased risk for depression and suicidal ideation, and higher levels of drug and alcohol consumption. In order to promote parental acceptance and reduce parental rejection and facilitate more open, closer, mutually respectful, safer, loving relationships between LGBTQ young adults and their non-accepting parents, we've spent the better part of the last 10 years adapting attachment-based family therapy for this population. And this paper presents the results of the first clinical trial testing the model. So we recruited 30 Israeli LGBTQ young adults and their persistently non-accepting parents. The families received up to 26 weeks of ABFT. We measured young adults' reports of their parents' acceptance and rejection and their own experience of attachment anxiety and avoidance at baseline, 8 weeks, 16 weeks, 26 weeks, which was the end of treatment, and at 38 weeks, which was typically 3 months post-treatment. We also measured parents' reports of their own acceptance and rejection at the same time points. So the results were that all but one family completed a full course of the treatment. Multi-level growth models revealed that both young adults and their mothers independently reported increases in mothers' acceptance. Young adults also reported decreases in both their mothers' and fathers' levels of rejection. Also, mothers, but not fathers, reported decreases in their own levels of rejection. Finally, young adults reported a decrease in attachment and avoidance in the relationships with both mothers and fathers, but not a decrease in attachment anxiety. Importantly, these treatment gains were maintained at 3 months follow-up. This study was the first to empirically examine the efficacy of a manualized, family-based treatment specifically designed to reduce parental rejection, increase parental acceptance, and improve relationships between sexual and gender minority young adults and their non-accepting parents. And despite the small sample size and lack of a control group, these findings are a promising first step. They suggest that attachment-based family therapy may be able to facilitate meaningful changes in parents' acceptance and rejection of their sexual and gender minority young adult children. This is important in light of the critical role that parental acceptance and rejection play in the lives of LGBTQ individuals. So thank you for listening, and we hope you'll read the paper.